Welcome to this presentation about EPSDT services for justice-involved youth. In this presentation, information about requirements in the Consolidated Appropriations Act, also called CAA 2023, Section 5121, will be shared. Contact information will also be shared at the end of this presentation to submit any questions. The CAA 2023 was signed into law on December 29, 2022. It requires that states must provide early and periodic screening, diagnostic, and treatment services and targeted case management services to incarcerated youth post-adjudication. These services are screenings for medical, dental, behavioral health, and other services. The requirements of Section 5121 are effective January 1st, 2025. EPSDT services must be provided to eligible youth within 30 days prior to release or within 7 days post-release or as soon as practicable post-release. TCM must be provided within 30 days prior to release and at least 30 days post-release. Who is eligible to receive these services? CMS defines an eligible youth as an individual under age 21 determined eligible for any Medicaid eligibility group, or an individual determined eligible for the mandatory eligibility group for former foster care children. Eligibility can be determined immediately before becoming an inmate of a public institution or while an inmate of a public institution. Section 5121 of the CAA 2023 applies only to youth being held post-adjudication as inmates of a public institution. Adjudication is defined as the court process that determines if an individual committed the act for which they are charged. States must provide EPSDT and TCM services to eligible incarcerated youth under age 21 and EPSDT-like services to former foster care incarcerated youth up to age 26. There are multiple types of youth carceral facilities. These can include state-operated facilities, locally operated facilities, for-profit and not-for-profit, privately operated facilities. A youth carceral facility could also include any type of state prison, local jail, federal prison, tribal jail and prisons, and all youth detention and youth correctional facilities. So what are EPSDT services? EPSDT is a mandated program designed to find children with actual or potential health problems to screen, diagnose, and treat any medical conditions. EPSDT screenings can be performed in initial, periodic, or interperiodic screenings, which are done between periodic screenings. EPSDT screenings are also known as well-child visits. A Medicaid-eligible child can receive an EPSDT screening and as a result receive additional medically necessary health care above normal benefit limitations. Additional health care requires a referral from an EPSDT screening provider. Information for EPSDT providers can be found in Appendix A, Well-Child Visit, or EPSDT, in the Provider Billing Manual. There is information in a webinar about EPSDT services located on the Medicaid website. Click on the Providers tab, EPSDT, and the Fundamentals of EPSDT presentation. Please note periodic screenings are not covered for telemedicine delivery, though interperiodic screenings are covered for telemedicine delivery. Information about telemedicine can be found in Chapter 112 of the Provider Billing Manual. Currently, Medicaid is in a partial readiness phase. Effective October 1, 2025, we are working to provide youth involved with the justice system, or JIY, at select Alabama Department of Youth Service campuses with access to EPSDT services. Medicaid is also engaging with other facilities soon. Medicaid desires to work with our current EPSDT providers for these services to eligible youth. Effective October 1, 2025, enrolled providers can provide and bill for medical and dental services. As a reminder, EPSDT referrals are required for eligible youth under age 21 for some services, but not for recipients ages 21 to 26. Medicaid may provide clarification at a later time. Medicaid anticipates higher reimbursement for EPSDT services given to eligible JIY recipients and will reimburse screening providers $88 for periodic screenings provided within 30 days prior to release and up to 60 days post-release. Periodic screenings are billed with CPT codes 99381 through 99385 and 99391 through 99395 with the EP modifier. How are the Alabama Coordinated Health Network regions involved? EPSDT providers can continue to work with their ACHN to manage care for eligible youth as needed. Eligible youth will receive TCM services from the Department of Youth Services prior to release and will transition to ACHN case management upon release. This is the end of our presentation. If you have questions, please send them to Alabama Medicaid via the email address physicians.program@medicaid.alabama.gov. Thank you for your time and attention.